Time is just gone 9:38 a.m. and it's time now to join the chairperson of the South African Medical Association, Dr. Angelique Coetzee. We're talking about the latest COVID-19 situation, mainly in the Gauteng province, and we've heard about the shortage of hospital facilities and beds, and also looking at the decision by the Gauteng Health Department talking about not opening the Nasrec Field Hospital. Dr. Angelique Coetzee, good morning to you. Welcome to the show.
Good morning. Good morning to all your listeners there.
Yes, now looking at this pandemic, the COVID-19 situation, Dr. Coetzee, all eyes of the country in Gauteng, where this pandemic is rife, it is rampant at this point in time.
Yeah, it is unfortunately rampant. It is actually running away with us, and there's no way that you can stop it now. That's unfortunately the realities. It's too late.
Key issue at this point in time in terms of Gauteng and how we are responding, how are we coping? And we see this on a daily basis where there is this dire shortage of hospital beds right across the province. And, people actually, we've heard about people being taken or flown to other provinces as a result of this shortage.
Yeah, well, unfortunately, there is, we were supposed to be better prepared for the second or for the third wave. We had two previous waves, and we should have been prepared much better, especially in the public sector. Private sector also struggling. And even if you open up Nasrec and even if you open up field hospitals at this stage, it's not really going to help you, as you only have so many people that can do the work. So, it's a huge HR problem. So HR problem, meaning it lies around the doctors and the nursing staff. And so you can open up facilities, but if you do not have the manpower to man those facilities, it's also not going to assist us. The army, that is a problem because the army, if they have not been vaccinated 30 days ago, then it means they themselves are now being, susceptible to get the virus because they are working now as frontline workers. And it's not an easy, it's not an easy virus. It's quite a difficult virus.
Well, Dr. Coetzee, I think from what you're saying, and I hear what you're saying, but I think the key issue here is, in terms of this entire pandemic, from the onset, from last year, there are huge question marks that are now being raised in terms of how badly this entire saga has been managed. Because from the onset, we knew that we were going to get the second wave, we were going to get the third wave. This was predicted already in March. And in terms of preparedness, we spent millions in like fields of on field hospitals, like for instance, or field facilities like Nasrec, for instance, which is basically lying dormant like a white elephant, and it's doing absolutely nothing for us. So again, once huge question marks in terms of how this entire process has been managed.
Yeah, I think the public's got a right to ask these questions, and I think the handling of this pandemic illustrates how poor our healthcare system infrastructure are. And it is not that no one ever said it before. We, from SAMA side, we raised more than once in the past. Our healthcare system is experiencing problems, and we need to look at again infrastructure, HR. You see the next problem that you now have with the interns, 288. At least we now have funding for 135 of those 188. But how on earth do we get ourselves in this kind of trouble? Who needs to take responsibility? Should it be the minister? Should it be the premier of the provinces? Should it be the MEC? Should it be Treasury? Where is all of this lying? I think it's a multi a problem. It lies on multi levels, but it is time to take responsibility.
Well, certainly, but it does appear as if nobody's taking responsibility, because in every aspect here, whether it's hospital beds, whether we're looking at the vaccination program, which we've fallen very, very far behind at this point in time. We've been talking about a herd immunity or population immunity being achieved, looking at all the targets, and this has become a moving target where none of these targets are being met all the time.
Yeah, it's true. It is true. Part of the vaccines rollout, was the problem that we couldn't, we ran into trouble with our medication, with our vaccines that needed to be delivered. We all know the problem with AstraZeneca. We all know the problem with Pfizer, where we are going to run out of stock if we don't get stock in quickly. We know what happened with Johnson & Johnson. But the point is, if we have placed these orders the beginning of not the beginning, before June, July last year, we would not have stand lost in the queue. There are enough money to procure these vaccines. It's not a money problem from Treasury side, but it's more a logistic problem. It is a problem of who, again, is going to take responsibility for what is currently happening.
And obviously, the fact of the matter is people are dying at this point in time. Hundreds of people are virtually dying. People are sick. People don't know where to go, who to turn to, what to do. And at the end of the day, it is creating depression. And, this morning, I just made a brief comment, Dr. Coetzee, about the psychological impact of COVID-19 and all this depression, all this negativity, all this stress around us, and what it is actually doing to people's mindsets.
Well, there is very nice studies around what it does to the healthcare workers, and it's clear that they've got emotional burnout. Well, even on the general practitioners level, we can see it. We are burnout. You see the same thing over and over again. But what also makes it quite difficult is that the families or the patients themselves are putting a lot of pressure on us, as well as the employers who want to have negative tests. And, you cannot believe what we hear on a daily basis. And the more we say that's not allowed, the more we are told you have to do it. So we've got so many bosses over us, and our voices are then not heard out there. It doesn't matter what we say from a medical perspective. The government is not listening to us. The patients are not listening to us. The people out there, the public is not listening to us. So, what do you expect? PTSD from the doctors with depression.
Well, it certainly is a very, very difficult situation to be in. And, I would hate to actually be a doctor in times like these, Dr. Angelique Coetzee. But just looking at it from your side, from the South African Medical Association, are you making any representations? As I said, the government is not listening. But at the end of the day, you are at the coalface. You are faced with the situation on a day-to-day basis. What more can be done?
Well, the government is not even listening to the advisory committees at various levels. So from SAMA side, all that we can do is we can keep on influencing advocacy as much as we can out there. We can keep on trying to alert the public. We can keep on trying to tell the public what is happening and asking them to adhere to the regulations and to keep safe. For now, we are advising the people out there that you are actually on your own. You need to understand that you need to take now responsibility. Government is not going to take that for you. National Department of Health is not going to take that for you. The hospitals is not going to take that for you. You now need to start taking responsibility and try to avoid any place where there's more than 10 people. I overheard this morning that a group of patients of mine, the work let them attend a conference where there are 7 in a car, and the one car fully, one was positive, and the rest of the people in that car is positive as well. Now, how on earth does that happen? We are saying the last more than 3 weeks. Please do not do this. Please stay out of public transport or any other transport. Please stay at home. Then how do you attend conferences? Are employers not listening? Are people not understanding it anymore?
Obviously, these are very, very critical questions that you are raising at this point in time. But I think for me, the big concern is when you say, Dr. Coetzee, that you are on your own. And I think this is actually quite serious, and it's a very, very serious statement to make.
Yeah, well, we can't put the virus back into a box or in a bottle. We can't do that anymore. We keep on saying, please avoid other people. We keep on saying that. And there's nothing more. I can only treat you. If you're my patient, I can treat you. I can try to get you better. But even if I treat you and I'm telling you, stay in bed, do not be physically active. You're only allowed to move from your bed to the toilet and back. Even then, people still don't listen. So, then I'm at this point in stage, of this pandemic and this third wave, where I'm asking, now what do you want me to do then for you? I'm telling you what to do, and you don't listen. So you are on your own.
Well, Dr. Coetzee, thank you very much for that, and all the best to you. Please stay safe, and we wish you everything of the best. I know it's difficult times, but please take care.
Thank you so much. And I just want to say to all the healthcare workers out there, just hang in. I know you don't want to hear you are heroes anymore. I know that you just want to get your job done and people to listen to what we are saying. And that's it. That's the bottom line. So please stay safe.
Dr. Angelique Coetzee joining us this morning, the chairperson of the South African Medical Association.